And good afternoon to everybody. It's my pleasure now to introduce Mr. Dodiey and Mr. Akmal. Mr. Dodiey is an outreach worker for CLASS, which stands for the Kuala Lumpur AIDS Support Services. And he has been highly creative and driven in advocating for sexual health among key populations at high risk of HIV and sexually transmitted infections. As a person living with HIV and with a background in accounting, he's passionate and invested in improving the life experience and basic rights of people living with HIV in Malaysia. And Mr. Akmal is the new addition to the CLASS family, currently acting as an outreach worker along with Mr. Dodiey. He is pursuing a part-time degree in psychology and is passionate about mental health and its relation to sexual behavior. It is now my pleasure to invite Mr. Dodiey and Mr. Akmal to share with us their topic titled Living with HIV/AIDS.
Hello. Okay, a very good afternoon to everyone. Thank you so much to Dr. Lim for the lovely introduction. First of all, I would like to say thank you so much to the organizer and also to the Taylor's team for actually give us me and Mr. Akmal the opportunity to join the webinar today. Thank you to also to Mr. Andrew, my president from CLASS, Mr. Shah, and also Mr. Azam, our program manager, for actually believe in both of us to represent CLASS for today's webinar. I think it's not too late to also wish to everyone happy World AIDS Day. I hope everyone is doing well in this pandemic time. So the topic was given to us was living with HIV and AIDS. I will not actually go too deeply about it because I would like to everyone to mainly focus on Mr. Akmal's session where he will actually introduce a little bit about you guys. What is CLASS, what CLASS do, what services that we do in CLASS. So again, hi. Without further ado, my name is Dodiey Hidahyat. I am outreach worker from CLASS, and I am also a PA-HIV, person living with HIV. I have been diagnosed with HIV since I was 18 years old when it was August 2018. Growing up, I don't really have that wide knowledge about HIV, STI, and so on. Not only because it's a taboo subject to talk in a daily basis conversation, but it's also the lack of exposure about sexual health and education during my school time. So when I was 18 years old, I could say that I am quite active in doing risky behaviors. I was just after graduated from my high school, I worked part-time with a luxury retail shop. It was my ex-manager who actually witnessed or actually saw things start to changing towards my body. As I said, I am not very well, during that time educated about sexual health education and so on. Plus, she has a connection with few people from the LGBT community. So where she knows a little bit too about sexual STIs, HIV, and AIDS. So she also well aware that I'm doing the having a risky behavior during that time. So she came to me when she start to see I have started to show out symptoms such as rashes in my body from my arm towards my neck until to my face, and a drastic change in my weight loss. So she actually asked me to ask me to go to screening, but as I said, I don't really know anything about and maybe I know few or two a bit about HIV, but only general, like saying that when we have HIV or AIDS, the last thing that we could do is die. That was what I was thinking. I never know that we have NGOs, these amazing NGOs that currently are fighting for advocacy in HIV and AIDS. So she linked up with me to one of her friends, where her friends then linked me to CLASS, one of the caseworker in CLASS, where we did connected, and then we talked about it. The caseworker briefly told what is AIDS, what is HIV, and so on. So the next day, he will link me up to the Clinic Kesihatan Ceras, where I will do my screening there for the first time ever in my life. So before walking inside the doctor's room, I have this feeling inside me that I feel like, what, maybe I am positive, because I have started showing this symptom, and what the symptom that shown in myself is aligned with those symptoms that I read in Google and so on. So as I did I walked in the room and I did my test. I think half an hour later on, the result came and I am positive HIV. During that time, I don't really feel anything, since I feel like because I think it's because I expected it already. So I just the doctor scheduled me for the next appointment for confirmatory test and so on. The next day I called my parents and I literally just told them that, hi mom, hi dad, I'm positive HIV. And my uncle was that time thought that I was like, making up stories, because he knew that I grew up as an attention seeker. So he thought that I would like create these stories just to gain this attention from them and so on. Until then, he followed me to the next confirmatory test, with me just to talk with the doctor and so on, just to kita kata untuk meyakinkan dia lagi lah. So since then, when both of us arrived at the clinic in Santa Cheras, he actually walked inside the doctor's room first. Then I had to wait outside. I think they have a private chat and so on. So after a few minutes, I think 15 minutes later, I was called by the doctor to come and sit with him inside in the room. Then I saw his eyes. He started to cry. Actually, he started to cry. Then that's the moment I feel like, the feeling of the sadness that I didn't feel the other day when I was to the first time test suddenly came and just wrapped me. And I feel like it's more of because I feel like I have embarrassed him. I have failed him. I think the guilt inside me that makes me feel like, oh my God, what have I done? But I could say that I'm a very, very lucky person that I have a very supportive family. He completely wiped his tears and then he said to me, you know what, Dodiey, we can go through this. Our family can go through this and so on. So he always consistently onwards, he will always remind me to go to appointments and so on and everything. Few weeks later on, I haven't started my treatment yet until I think it was 1 month or something, because I have a very bad discipline with the vitamin training. For those who don't know, before we start our ART, we will give it a vitamin training for us to be disciplined towards the treatment, the real treatment soon. So during that time, I am very not disciplined, and then they give me also bacterium. One of a medicine called bacterium, and I had allergies towards the bacterium, where I suddenly start to my body start to weaken, and then I had to ward it for I think 3 weeks like that in the HUKM. Until then, my caseworker during the first time, my caseworker consistently will always check up on me, and then when I was warded that time, I think that is the end of the time. I think it is the end of me. I think I will not make it. My family think that I will not make it. But thanks to the caseworker from the class, he actually the one who actually will like suit my family, who actually make my family feel better and so on. So that I really I would say that I am grateful to my caseworker and so on. Until I was discharged from the hospital, I started my heart. And I forgot to mention you guys that the first time that I did once I did the confirmation test where they draw up blood for the virus load and also the CD4 counts and so on, my CD4 was 114, which is actually already 8 state. 18 years old with the 8 state is quite shocking. But somehow I feel like no, this is not the end of the time. This is not the end of me. I want to do much more because I'm so young. I'm 20 today. And I feel like I want to do more and more. So by then, since I'm very open with my status, I would say that being an open person living with HIV, where you open up your status and tell to everyone, like when they ask about your status and so on, you will face so much consequences. And I would say the one thing that the consequence that I always have to face is the stigma. I get it. I don't blame to anyone because they are not well educated. They have less knowledge. Like me, when I was way before I went to the test, I get it. But some people out there, I mean, I feel it, you know, depressed and so on because of the stigma and everything. So at one point I feel like, you know, I had enough, because I would say that after I did the treatment and so on, the treatment started doing well with me. I still had to go to the hospital for follow-up tests, for my FMS, for just to top up my supply of my medicine and so on. So I will literally, like, every month I will have to take MC leave. So my superiors from different my work will ask me, why do you have to take a leave? Why always every month the same day you have to went for MC leave? So I have to be open and just tell my status, and you know, that kind of made me have to, you know, withdraw from the position. And I would say that I think I can remember the moment after the treatment. I had that 1 year I had to drop my work for 2-3 times. I had to be jumping around job, and I said to myself, you know what, maybe this time I had to do something else, you know, maybe not in retail, maybe not in F&B, maybe I had to do something. Because truth to be told, way before I joined class, I did my own advocates, even not that in a very wide scale, but I did advocate to my friends, to my circle, so even to my followers in my Instagram and so on. So I already been an outreach worker way before I joined class. Then my family actually, my caseworker, then also you know, convinced me to, why not you drop your resume in class, and you know, try to help these people with more connection and so on. So it quite took me a while for actually, because I don't really believe in myself during that time that I could, you know, be an outreach worker or so on. But you know, finally I did. Maybe God also nak tolong I somehow I am here to talk with you guys about a bit of highlight of my so not so bittersweet journey about as a living with HIV, living with HIV. So that's all I think from me, because like I said, I would like to everyone to mainly focus on Mr. Akmal's session, which is after me. So Mr. Akmal, the floor is yours. Thank you so much. Yeah.
Hi, Mr. Akmal. Can you increase your volume a bit? We have some problem hearing you.
Can you hear me? Yeah, what?
Hear you, Mr. Dodiey.
Where is Mr. Akmal?
Mr. Akmal is. I can see.
Okay, yeah. Hi, Mr. Akmal. Okay, the floor is yours. I thought you went MIA and you left me. Don't left me here. Okay, I give the floor to Mr. Akmal. Yeah.
Okay, thank you. Yeah, thank you again, Dodi, for that very inspirational sharing. Seriously. Okay, and now I'm going to talk a little bit about what we are. So we are actually an NGO, as you all know, named CLASS. CLASS stands for Kuala Lumpur AIDS Support Services Society, and we are actually established in 2001. Next slide. We are actually established in 2001 by a medical professional. And since then, CLASS has been pioneering the community-based HIV support services in Malaysia by filling in the gaps in existing facility-based services and augmenting professional and community knowledge to provide more effective HIV care. And yeah, the HIV support services that we offer encompassing comprehensive care across the care cascade, and it includes community outreach. This is via online dating apps as well as social media. And we also facilitate HIV testing, linkages to care and treatment, as well as individual group peer support, treatment compliance activities, as well as social safety net and temporary shelter for people undergoing HIV treatment. Next slide. CLASS is actually part of only one of the many partner organizations that are registered under Malaysian AIDS Council. And this is basically the breakdown of our main activities. It can be separated into three. The first one would be outreach workers and case workers. What do we do is that we reach out to the community via dating apps and social media. So we actually do online sexual health advocacy. We talk to them about sexual health, about STIs and ways to actually protect themselves. And not just that, we also persuade them to come to do testing, or we call it VCT, voluntary counseling and testing at government clinics, as well as community-based testing at our own offices. And next, for the caseworkers, what do they do is that they would manage the clients or patients that come to the clinic who are tested positive, and they would manage and try to retain them in treatment. So let's say if they have any difficulties at the clinics or whatever, our caseworkers will be there to actually assist them. And not just that, we also give out commodities to the at-risk key populations, which mainly would be condoms, loops, and even informational flyers. Next, we have treatment adherence peer support, or we call it TAPS. These are PLHIV peers that are stationed at hospitals. And what do? Is they provide counsel, also group support and mentorship to newly diagnosed PLHIV in order to encourage them to adhere to the treatment. Okay, and lastly, we also have our class care center. This care center acts as a temporary shelter for people living with HIV that has nowhere to go. Okay, next slide. Okay, these are the statistics sort of from our community-based testing. Due to CMCO, right? We started to do this CBT program from June until October 13th. And from this short period of time, we actually managed to reach up to 557 people and get them tested. And from these, you can see there are 34 from the people that came actually HIV positive, as well as 2.51% are reactive for syphilis, and less than 1% are positive for hepatitis C. Next. Yeah, these are the breakdown according to months. Yep. Okay, next slide. Okay. These are some of the struggles and challenges that we managed to get from our clients. From their sharing of their experiences at healthcare providers at clinics. Okay, the first concern would be the stigma from healthcare providers. This includes not just doctors, but also nurses, medical assistants, and even admin staffs at the registration. Okay, usually they would report that the HCP are kind of prejudiced, judgy, and might as well kind of be condescending quite a bit. So this is actually a huge issue, which actually resonate back with Prof. Adiba as well as Dr. Vicky's slides before. You know, stigma is actually a huge issue that actually prevent us from reaching out to the community and bringing them to come and get tested. And next we have, okay, divisive message on HIV and key populations. Okay, this is another problems that we can see, you know, because if you see from organization abroad, right? The message on undetectable equals untransmittable is actually very clear. However, when people are recently diagnosed with HIV, and then some of the doctors who counsel the patients might actually say something like, oh, HIV can be treated, but if you did not adhere to the treatment, you might get resistant to the drug, and then you might need to pay for the second line treatment. So this kind of message is whereby it is actually warranted, right? It is true, but then it's sort of like scaremongering and kind of confusing for the newly diagnosed patients. And so what do these people do rather than they retain in treatment? Rather not be in treatment at all. Okay. Next, yeah, it actually circles back to the divisive message again. Lack of endorsement on U equals U. U equals U stands for undetectable equals to untransmittable, which as Dr. Vicky explained before, when PLHIV managed to suppress their viral load to undetectable level, they practically cannot transmit the virus via unprotected sex. But we rarely see, how do you say, doctors endorsing this message on social media, because social media is one of the main sources for the KPs to get information. Because we are in a conservative country, so the main place they get information on HIV and all those things are actually from social media. So we really do need more doctors to actually endorse this message on social media and try not to be divisive about it. U equals U is actually scientifically proven, and scaremongering, stigmatizing all those things, it doesn't help. But U equals U actually give PLHIV hopes, and it actually will improve their life. So I strongly believe that U equal U message is actually the key to end not just HIV stigma in HCP, but also the society as well. Because when they know that PLHIV can suppress the virus, and when they do that, they cannot transmit the virus. So there is actually, how do you say, no use of stigma anymore. Yeah. And then another insight from our director, Mr. Andrew, he said, some of the doctors, especially who are maybe raised, maybe due to religiosity or maybe due to like conservativeness or something like that, they might not agree with the patient's lifestyle and all those things. But try not to let that get in your way in counseling with the patient. Try to imagine like you are actually talking to your family members. I think if you put yourself in this position, it would help you to, how do we say, be less stigmatizing towards the patient, and say, give them hope. Yep, ultimately, yes. And next would be accessibility to PrEP. PrEP it stands for pre-exposure prophylaxis. This is a 1 day and 1 day pill that, if taken consistently, can actually prevent HIV infection. But then in Malaysia, there is a problem whereby one of the main problem would be the price. It can cost from 80 ringgit to 200 plus per 1 month supply. And not just that, there are also some scaremongering and misinformation. Also circles back to the divisive message, because scientifically PrEP works. It actually works better than condoms, to be honest, because if you put it into perspective, right? If you are using condoms, but then your condoms break, so what would happen, right? You need to take PAP, post-exposure prophylaxis, which costs a ton more, maybe a few hundreds more. But then if you took PrEP, you know, it can actually protect you from HIV. So we really need to streamline the message on PrEP and make sure that, you know, there is no wrong door approach to this. Because, you know, another thing that we need to take into consideration is that not everyone find condoms to be favorable. So some people might be sensitive to condoms, especially people who actually involve in sexualized drug use. And some even reported to having trouble staying hard in it. So yeah, so this is mainly why we need to have alternatives, and we need to have that no wrong door approach. And next, the accessibility to community friendly HCP. This is another problem because our community are, as you all know and well aware, are quite marginalized and stigmatized. So our people, the community are quite afraid to actually come forward and get tested. So these are one of the issue. And the clinics that are allied with NGOs sometimes located like quite a distance from their location. So yeah, that is one of the constraints, as well as operating hour of the clinics themselves, because not everyone have free time during weekdays, right? So yeah, but this actually can be solved with our new program, which is the community-based testing. And lastly, would be lack of local data and research on key population sexual behaviors and sexual health. This is one of the things that I think we need to, how do you say, need to improve on, I think. Yeah, because there are claims on, you know, drug resistance on people who are using PrEP, but then when I try to look for the papers, local papers, but I think there are none actually reported on this case. But there are doctors on social media that says that they have patients who are actually HIV positive even though they are on PrEP, and but then it is not reported. I couldn't find any papers on that, and as well as there are lack research on chemsex as well. I think I found only a few done by Dr. Howie and Prof. Adiba, if I'm not mistaken. And yeah, if we, because HIV is actually a very interesting niche as well. So I think there are a lot of opportunities for doctors and researchers to actually look into this field. And not just that, because we from the NGOs are not from medical background, most of us are not from science background as well. Hence, the knowledge gap is quite jarring. Thus, I think if these universities and NGOs could, you know, do a collaboration, maybe we can, you know, lessen the knowledge gap. Okay, next slide. Okay, these are some of the challenges that we experience from our clients as well. You know, most of them are actually afraid to come forward to get tested because of data privacy and confidentiality concern. This is because, you know, when you go testing at clinics, you will be needed to give your identifiable information such as your full name, such as your IC, and knowing that we are actually kind of marginalized and stigmatized, so they really are quite reluctant to give out this information. So this is one of the issue. And then secondly would be the lack of sexual education and awareness. This is just like how Dodiey said, you know, we in Malaysia might be due to conservative, us being very conservative. we don't have comprehensive sexual education. Hence, the people at risk do not really know how to protect themselves. So we from the NGO can only do so much. We can reach out to them via dating app, but then on dating app, people are there actually to look for one thing. So when you are trying to do advocacy in the place that people are looking for something else, there might be some, how do you say, contradicting message there. And next we have internalized stigma. Yeah, due to the, how do you say, the ongoing stigma from healthcare providers, from the society, this might indirectly cause the clients to be indecisive, might be afraid to know their status, because they're afraid to be judged, afraid to be preached by the SCPs, because of the lifestyle, the differences of in lifestyle, and they often do not feel empowered. So that's why there is actually a post from an organization abroad in UK that says that countries that criminalize all these things like drug use as well as LGBT community and all those things, it actually prevents or deter the community, the at-risk people from coming forward to get tested. So these are one of the issues, I think. And lastly, the rise of sexualized drug use. This is another uprising issue that we see. People are addicted to crystal meth, and they actually use it for group sex. And yeah, they are actually quite, they have a couple more times of risk of contracting HIV. And we really do need to figure out a way to actually penetrate into this segment. And perhaps, another problem is when people are on crystal meth, right? They do not like to use condoms. So this is where we need to introduce them PrEP so that they can actually protect themselves. Okay, next. Next slide, please. Okay. Okay, so for our future plans and opportunities, we actually would like to do like a research collaboration with universities on topics relating to HIV, people living with HIV, community health, sexual health, pathology, mental health, nutrition, aging, and all those things. Because HIV is actually a very interesting niche. You can actually study a plethora of fields from it. So we hope that more of these young doctors will be interested to do collaboration with our organizations, and we can help you to reach out to this niche. And next, expansion for community-based testing. Yeah, to accommodate our clients' need for a more flexible, timed, and accessible testing center. Maybe we can collab with doctors or clinics, to accommodate like 1 or 2 days per week at the clinical or at the universities, so that the people at risk can come there, can visit there and get tested. So these are one of the suggestions. And not just that, we also have this new program coming up, which would be launching in this month. It is called Hercules. Yeah, it is actually a mental health and nutrition clinic, and we are going to do it at class. So if you guys are interested, please follow us on social media, and feel free to contact us to know more about it. And lastly, ending AIDS 2030, like Prof. Adiba said, if we can actually end the HIV-related stigma in healthcare providers, we can actually hope for a future that are free of AIDS. Yep, that is what I strongly believe in. And we from the NGO are striving to achieve. Okay, and lastly, even though we are actually funded by Global Fund and partially by MOH, but because we are a non-profit organizations, we do appreciate if any kind of donation from people. So yeah, basically you can donate via these options here, via online or check or cash, and you can see here our account number. So yeah, I think that's all from us.
Yes, thank you so much, Mr. Akmal and Mr.
Yep, no
Dodiey, for
problem.
sharing your experience with us. And we will also share the donation link information in our Zoom chat box later. Okay, so moving along,